Hi, my name is Chastin Freejay, and this is my recorded health assessment. My patient today is Mr. Ted D. Bear. His birth date's 1/9/92, and he's allergic to penicillin and erythromycin. I'm going to know this because I'm going to look at the chart before I go see my patient, and when I get in the room, I'm going to perform hand hygiene. With me personally, I'm going to wear gloves for every patient. And I'm going to ask him to verify his name, his date of birth, and his allergies for me. And I'm going to compare that with what his chart said, with what he tells me, and also with what his wristband says. And once that's verified and everything's correct, I'm going to ask him if I can do a head-to-toe assessment on him. He's going to say yes. And I'm going to let him know that first I'm going to check his pupils. So I would check for accommodation. Good. Alright, now I'm going to check for the pupil size. They're going to be equal. I'm going to check for reaction. Okay, so his are non-reactive. Hopefully all of our other patients are going to actually have reactive pupils. Next, I'm going to listen to lung sounds. So Mr. Bear, I'm just going to listen to your lung sounds. These lung sounds are going to be listened to with the diaphragm of the stethoscope, and they're going to be listened to underneath the gown. You never listen to lung sounds over the gown. So I'm going to listen to all lobes. I don't know if you see this. So I'm doing left and right sides, comparing. I'm having him inhale. I'm listening to a full inhale and exhale at each spot that I'm listening to. So all of those sound pretty equal and clear. So next I'm going to have him sit up so I can listen to posterior lung sounds. So he's going to sit up, and I'm going to listen to both the left and the right sides, comparing all lobes. And then I'm also going to listen to lateral breath sounds. So I'm going to listen here. In the same place on the other side. I'm going to listen. Full inhale and exhale. So everything sounds clear. That's really great. All right, you can lay back, Mr. Bear. Next, I'm going to listen to heart sounds. So I'm going to turn it to the bell of my stethoscope, and I'm going to listen to the aortic, the pulmonic, the tricuspid, and the mitral. All right, so all of those sound really good. Next, I'm going to listen to the abdomen. Well, first I'm going to, can I assess your abdomen? Pull down your linens. You can say yes. I'm going to pull down the linens. I'm going to look at the abdomen first and look for any distension or redness or swelling. Then I'm going to listen before I palpate anything. And again, I'm going to use the diaphragm of my stethoscope for this. So I'm going to listen to all four quadrants. I'm listening for bowel sounds. So all of his bowel sounds sound great. That's really good. So next I'm going to palpate the abdomen. You let me know if you have any tenderness or pain. Then there, and there. All right, great. No pain. That's really good. All right. So the next part of my assessment, I'm going to assess pulses. First in his upper extremities. And I'm going to listen to both sides, or feel both sides at the same time so that I can compare them. Make sure they're equal, they're +2, they're good. I'm going to check cap refill. Okay, less than 2 seconds. Great circulation. Next I'm going to check your feet. I'm going to feel for the pulses. I'm feeling both sides bilaterally to make sure that they're both equal. I'm going to check cap refill in both lower extremities. It's less than 2 seconds. That's great. Now I put the linens back up. That's a great health assessment. He's looking good. See you later, Mr. Ted D. Bear.